Hello, this is Dr. Shashikumar Menon from Pharma Analytical Sciences of Ramnarayan Ruya Autonomous College, Mumbai. We all have just come out of lockdown containments, are restarting our daily routines in the unlock phase. The threat of COVID 19 still looms large, and now a new reality is facing us. We all have to live with COVID 19, at least till a vaccine would save us. In this video, I am going to share with you what science tells us about the ways to deal with the threat of COVID 19. I request all of you to please use your earphones for better audio quality. The SARS-CoV-2 or the novel coronavirus is a cause of COVID-19. It is a RNA virus and infects human cells by attaching to the ACE2 receptor proteins found on the cell surface. Once they attach to ACE2 receptors, the virus particles enter the cell and are carried inside. Once inside the cell, the virus starts replicating and new virus particles are then released outside the cell to infect other cells. The novel coronavirus is transmitted from one person to another through respiratory droplets and by contact. Respiratory droplets are produced when someone sneezes or coughs. These respiratory droplets don't remain suspended in the air for long, but they settle down. So people within 1 meter distance of an infected person is in risk of getting the droplets into their airway. The respiratory droplets can also contaminate nearby surfaces, and the virus particle can transmit to clothes or hands of people coming in contact with such contaminated surfaces. Therefore, social distancing, use of mask, frequent washing of hands thoroughly with soap and water, or alcohol based sanitizers are good preventive measures for COVID 19. Let us now see how the disease progresses inside the body. The attachment of novel coronavirus to the ACE2 receptor is the basis for the clinical manifestations of COVID 19. Let us look at the sequences of events in a simpler manner. Blood pressure in our body is also maintained by a combined role of liver and kidneys. The liver secretes a protein called angiotensinogen, which circulates in our blood as an inactive molecule. Whenever the blood pressure falls, the kidneys secrete another protein called renin, which converts angiotensinogen into a partially active angiotensin 1. This less active angiotensin 1 circulates in the blood and reaches the lung, where it comes in contact with two other enzymes, the angiotensin converting enzyme 1 and angiotensin converting enzyme 2, or ACE1 and ACE2. ACE2 through the ACE2 receptor converts angiotensin 1 to fully active angiotensin 2, which causes the blood pressure to rise. The angiotensin 2 through the angiotensin receptor 2 is converted to angiotensin 1,7, which has several good protective roles like reducing the inflammatory responses caused during the infections and also help in the growth and repair of blood vessels. Thus, it helps in keeping the lungs healthy. The ACE1 similarly through ACE1 receptor produces fully active angiotensin 2, which increases the blood pressure. When the novel coronavirus attaches to ACE2 receptor, all the pathways mediated through ACE2 gets impaired. Thus, the more efficient ACE1 takes over, resulting in excess production of angiotensin 2, which through the angiotensin 1 receptor causes increased lung permeability. This leads to fluids from the blood filling in the lung, causing impairment in breathing. The respiratory distress and the infection of virus triggers many inflammatory responses that result in cytokine storm and acute respiratory distress syndrome. This further causes accumulation of cell debris which could clog kidneys, leading to kidney failures and further to multiple organ failures. Many COVID-19 patients have been reported to have developed clots within their blood vessels. Let us now look at the etiology of such blood clots in COVID-19. Our metabolic activities in the cells produce reactive oxygen species or ROS. These reactive oxygen species can't be allowed to remain for long since they can cause damages in the cell, especially the lipids in the cell membrane. A part of this reactive oxygen species is taken up by nitric oxide to form peroxynitrite. Peroxynitrite also damages the lipids in the membrane. In very small concentrations, however, both reactive oxygen species and nitric oxide act as chemical signaling molecules in the cell. But in higher concentration, they are toxic to the cell. So, our cells have system to remove these. The excess reactive oxygen species is converted by superoxide dismutase into less harmful hydrogen peroxide. Hydrogen peroxide is further converted into harmless water by an enzyme system based on catalase and glutathione. Superoxide dismutase needs minerals like zinc, copper and manganese for its functioning, while catalase needs iron. Reactive oxygen species is also cleared by vitamins B, C and E. Thus, it becomes clear that adequate levels of vitamins and minerals in our body are important to reduce damages caused by toxic free radicals. Angiotensin II also causes the production of reactive oxygen species. But ACE2 converts angiotensin II to angiotensin 1,7, which stops such production of reactive oxygen species. During the infection by the novel coronavirus, the virus particle attaches to the ACE2 receptor and this impairs the function of ACE2. This results in overproduction of reactive oxygen species by angiotensin II. Additionally, the virus infection triggers activity of white blood cells, which initially is a good response to stop the infection. But as the virus infection progresses, the increased activities of white blood cells also cause production of reactive oxygen species. This high levels of reactive oxygen species result in oxidative stress, which badly affects the cells of the blood vessels, triggering release of clotting factor. This causes platelets to aggregate, causing clots in the blood vessels, leading to thrombosis. These blood clots can quickly lead to fatal consequences. Thus, blood vessels are secondary targets after lung for novel coronavirus. The novel coronavirus enters our airways mainly through the nose and mouth. The ACE receptors along the airway guides the virus into the lungs as the infection progresses. Though the progression of the disease differs in people, generally the first 2 days are asymptomatic. In the next few days of infection, the virus slowly migrates into the upper respiratory tract. At this second stage, clinical symptoms are manifested and the body responds with very active immune reactions. RT-PCR tests at this stage 1 and stage 2 may give false negative results up to 40%. So several clinicians prefer to do a CT scan of lungs to diagnose the infection. As the disease progresses further, the virus starts infecting the air exchange units of the lungs, the alveoli cell type 2. This leads to difficulty in breathing. About 20% patients enter this stage 3 and such patients will need hospitalization and oxygen support. In 5% of the patients, the virus starts infecting the cells of the blood vessels, leading to severe oxidative stress and formation of clots in the blood vessels. Such patients in stage 4 are at risk of reaching a critical stage with multiple organ failures. Contrary to expectations, there is relatively less incidences of COVID-19 in patients of tuberculosis, AIDS and in patients with chronic lung diseases. Most of the patients who enter stage 3 and stage 4 are people who are obese with body mass index more than 30, patients with cardiovascular problems, diabetics with high blood glucose levels, patients of renal diseases, and those who have already high oxidative stress due to other non-COVID infections, or those who have just recovered from recent infections like jaundice, malaria or dengue. As we have seen in the earlier slide, COVID-19 clearly has characteristics of an endothelial disease over its pulmonary disease expression. So, if COVID-19 is going to stay with us, how can we prevent it? Vaccine would be the best bet, and let us hope science can give us an effective vaccine soon. Till then, use of mask that adequately covers nose and mouth can help us prevent infection up to 75%. Face shields are more convenient than masks but are good for a non-infected person and are not effective in vicinity of a COVID-19 patient. Maintaining social distancing of minimum 3 feet is very effective. Sanitizing hands or cleaning it with soap and water intermittently is also a good way to ensure prevention of infection. Any physical contact with people should be avoided totally. Maintaining a healthy immune system is very important, and it can be done by consuming nutritious food rich in proteins, vitamins and minerals. It will be a good idea to supplement the daily diet with multivitamin and mineral capsules, especially for people above 50 years of age. Younger people can use supplements for 5 days a week with weekend breaks to prevent over-supplementation. Egg is a very good natural supplement and can be consumed in moderation. Drinking water regularly will provide adequate hydration. Practicing deep breathing whenever possible can help maintain healthy lungs. There is definitely a need to be alert, but not to be anxious and frightened. In case COVID-19 has reached your immediate neighborhood, or if you are in vicinity of a COVID patient with higher chances of infection, then use of N95 certified masks will be very useful. Maintaining social distancing, sanitizing hands and avoiding all kinds of physical contact with others are very essential. As a precautionary measure, you can start hydroxychloroquine, which has been found to be effective during initial stages of COVID-19. Taking vitamin and mineral supplements will be a good idea. Drink water to keep oneself hydrated adequately and deliberately take deep breaths intermittently to oxygenate the lungs efficiently. Use of paracetamol and cetirizine is also recommended as SOS measures. Clinicians and health officials are now confident that early stages of COVID-19, especially the asymptomatic positive patients, can be managed at home with adequate quarantine measures. The early symptoms of COVID-19 are similar to cold and flu. With the virus attaching to ACE2 receptors of sensory cells in nose and mouth, some people lose the sense of smell or taste. The health authorities must be informed about the infection. Hydroxychloroquine, paracetamol with antibiotics like doxycycline should be started at this stage. Ivermectin and famotidine are also found to be beneficial. Supplementation with vitamins and minerals is essential. Healthy food with adequate consumption of water is very important at this stage. Gargling with medicated mouthwashes can reduce the virus load on throat. Oxygen supplementation with 1 second puffs from portable canister can be a very supportive treatment to vulnerable patients, especially to tide over delays in getting professional medical attention. Deep breathing and rest are important at this stage. One important way to monitor progress of the disease is to keep a tab on the oxygen levels in the body using a pulse oximeter. If oxygen levels fall below 90, then immediate hospitalization is required. This can be very useful in managing vulnerable patients of COVID-19, especially to prevent them from progressing to stage 4 with respiratory distress and oxidative stress. The progress of COVID-19 depends on the vulnerability of patients, and therefore these measures, if initiated in time, can be life-saving. COVID-19 patients with breathlessness definitely need hospitalization. Palliative oxygen support should be provided if there is a delay in getting professional medical support like ambulance and hospital admission. A quarter of such patients may need ICU with ventilator support. Treatment with antiviral drugs should be initiated under medical supervision. Many supportive treatments like convalescent plasma therapy and administration of drugs to prevent inflammatory responses have been found to be very effective. Injectable monoclonal antibody based drug tocilizumab has been found to be life-saving in several cases. Use of nitric oxide inhalation, oral indomethacin and dexamethasone have also been found to bring down the severity of pulmonary infection and oxidative stress caused by novel coronavirus. There are several claims of using traditional medicines, especially Ayurvedic formulations, in the management of COVID-19. It should be kept in mind that the progression of COVID-19 to criticality in many patients is quite fast. Therefore, traditional medicines alone cannot be used in management of the disease. Some of the medicinal plants and traditional formulations can work synergistically as adjuvant therapies. Traditional medicinal formulations can be used in prophylactic measures as immunity boosters and in mild and moderate infections. Several classical Ayurvedic formulations can be used as adjuvants. Rasayana based formulations, however, will need medical supervision for their usage. Many proprietary Ayurvedic formulations have made claims of cure for COVID-19, but these need proper scientific studies to confirm their therapeutic claims. It will be a great scientific advancement for India with a huge legacy of knowledge of traditional medicinal systems to consciously manage prevention and treatment of COVID-19 using a combination of modern medicines with traditional medicines. With the emergence of novel coronavirus, a pathogen unknown till now, the scientific world has been posed with new challenges in controlling the pandemic. Science is still unraveling the specifics of the disease progression and is still in search of a treatment for COVID-19. We know for sure that out of the total infected individuals, majority of them come out of the disease with mild symptoms, while only 20% of them require hospitalization. Only 5% of the patients progress to the critical stage. So, timely detection and continuous monitoring of disease progression is very essential. The vulnerable population who are with comorbidities need to be specially taken care of because they are the ones who could quickly progress to critical stages due to respiratory distress and oxidative stress. In all these discussions, let me again reiterate the importance of simple but very effective preventive measures like the use of masks, maintaining social distancing, and sanitizing hands with alcohol based sanitizers or by washing with soap and water thoroughly. Consumption of healthy, nutritious food can boost up immunity and can not only prevent the disease but also help in retarding the rate of disease progression. We must cooperate with the government agencies by strictly adhering to the guidelines of the health department. Looking forward, we must realize that novel coronavirus is here to stay till we are able to eradicate it completely. So we need to be prepared to come out of our houses knowing fully well that the risk of COVID-19 is still there. Though there is uncertainty and anxiety in the air, we need not panic and be frightened. Science has shown us ways to prevent COVID-19, And today, clinicians are more confident of managing COVID-19 patients, and many of them survive even the critical stages of the disease. So, this crisis will also pass. We must move forward with renewed hope that science is not far away in giving us a cure for COVID 19. Thank you. Thank you for watching.